All right, so the patellofemoral joint is one that creates a lot of havoc. It's not necessarily going to create a season ending injury, but it's going to create a lot of discomfort if our muscles are not in balance, if our knee is not in proper alignment. If we are doing activities where we're putting too much pressure through the knee, it's going to create pain and discomfort that we don't necessarily want. So we're going to start out with talking about what the patellofemoral joint is, how it's assessed, and talk about different pain symptoms. Then we'll get into some drawings and show you what the different things look like. All right, so first off, as we increase the knee inflection, the joint force increases. So if we are sitting at 90 degrees, okay, 90 degrees is right here. And right here where my fingers are, that, let's say, is the patella. So if we're sitting right here and we flex our knee, we are putting a lot more force in this joint. Whereas if we extend it out, we are making less force within the joint. Okay, so that's what that means. As we increase the joint inflection, we increase the amount of force. So what happens is that force is pulled through the patella, through the quadricep tendon, through the patella tendon, and it creates more discomfort. All right, which is why a lot of people don't like doing deep squats, which is why jumping creates a lot of discomfort if our muscles are imbalanced. Now, it's not going to create discomfort the first time we do it. It's going to be more of a chronic injury or an overuse type thing where we have pain with activity as we move along. All right, so when we are on a level surface walking, we increase the joint reaction force by 1.5 times our body weight. So if we weigh 100 pounds, we have anywhere from 100 to 150 pounds going through our body, going through our knee at the time. All right, stair climbing. Stair climbing can be very uncomfortable for someone who has patella tendonitis or for someone who has patella malalignment and their kneecap is not tracking properly. It's going to cause them some discomfort in the front of the knee. Stair climbing increases the weight distribution by 3 to 4 times. So if we weigh 100 pounds, we have about a 300 to 400 pounds of pressure going through our knee. Same with squatting. Squatting is very important for athletics, athletic positioning, getting in the right positions to play your sport. You have to know the proper technique of squatting and the proper lifting techniques when you're in the weight room. This will help to decrease the amount of pressure going through the knee if we do our lifts properly. When we don't lift properly and we let the knee go over the ankle, meaning that it moves forward too far, we increase this body weight a lot more going through the knee. So it's going to increase the pressure going through the patella. So what is patellofemoral pain? Patellofemoral pain is a general pain in the front of the knee. All right, so it's a diffused ache. Sometimes it's pain when we are stair climbing. Sometimes it's what's called moviegoer's knee, because when we're sitting in a movie theater, our knees are bent and we're sitting there for a long period of time. So when we go to stand up, our knees are a little weak or discomforting. We also would have crepitus. Crepitus is the technical fancy term for clicking and popping. Also, patellofemoral pain can cause the knee to give away. Doesn't mean that you've torn your ACL, doesn't mean you have a meniscus tear. It just means that the joint forces, the joint structure is not 100% and its receptors in there are not getting the signals that they need to get, so the knee gives away. You also might have some swelling and some locking and some catching, or say what most people will say is my knee just locks up and I need it to pop. Sometimes that is a sign that someone has some patellofemoral pain going on or patellofemoral syndrome within the knee. All right. So, how is the patellofemoral joint supposed to work? Well, first off, the patella is in place to increase quad control. The quadricep tendon comes down and wraps around the patella and into the patella tendon. What it helps is during the first 20 degrees of flexion, the tibia will derotate, meaning that it will turn inward and the patella draws into the trochlear groove. Trochlear groove is that indention you remember on the between the femoral condyles. All right, when the tibia derotates, it causes a decrease in the Q angle. The Q angle is the quadricep angle. So when our knee is bent, we have a smaller Q angle. When our knee is straighter, we have a greater Q angle. All right, the patella will stay in the trochlear groove for about 90 degrees and then it moves laterally. So when your knee is fully flexed or fully bent, your kneecap actually sits above the trochlear groove and a little bit to the outside. When we talk about patellofemoral problems, or we're assessing the patellofemoral joint, we look at the lateral forces. What is resisting the lateral force? What is aiding the lateral force? All right. When we talk about resisting the lateral force, this is what's helping the patella to stay in true alignment. The medial retinaculum and the VMO, which is a smaller part of the quadricep muscle. You notice there's only one muscle here. Okay, you notice down here in what aids the lateral forces, you have the vastus lateralis, the IT band, and the lateral retinaculum. So it's like a 3-to-1 ratio. So you have a lot more on the outside of the knee that is pulling the kneecap outward. Again, which makes it very important that when we are doing quad strengthening, whether we're doing lunges or squats or wall sits or any lower body activity, that we are in proper alignment, keeping the knee in the right place and not letting it move too far forward over the foot. Okay, so that means we have to stay back in our heels, we have to keep our hips back and hips up, and then we need to make sure that when we are bending fluidly. Okay. But that gets into a lot of weightlifting components, which I'm not going to get into here in our notes. All right. So like I said, the only medial stabilizer is the VMO. It needs to be active through the full range of motion, and your VMO and your vastus lateralis need to have a 1-to-1 ratio. All right, the next section of your notes is talking about patella malalignments. Mal means bad, so a malalignment or a misalignment means it's not going to be in the normal position. So if it's not in the normal position, it's going to move one way or the other. So what I've shown you here in a very one-dimensional basic picture is you have the condyles, which look like the mountains, and then the valley here is the trochlear groove. The single line denotes where the patella would sit. So for a normal knee, the patella would sit right in the center of the groove and it wouldn't glide either way. All right, for a lateral glide, on the other hand, you see the patella moves slightly to the lateral side, whether it's the right side or the left side, just depends on which knee it is. Okay, but it moves to the lateral side. All right. A lateral tilt means that it's going to angle itself towards the lateral side. Rotation means that the inferior pole, inferior means below, so the inferior pole is not lined up right in the center of the patella on the superior border. All right, it's going to be angled more towards the side. So when someone has these rotations, we can actually do a tape job, which is called McConnell taping. We can do a tape job to help bring this back into normal alignment. And then the last one is the anterior posterior tilt. This is looking at the knee from a side view. So here would be the femur, this would be the condyle, and here would be the tibia. So this is my joint space right here. All right, and so a normal kneecap should lay flat. All right, one that has an AP tilt angles from the anterior to the posterior. So it's pushing in to the tibia. It pushes into the fat pad. It creates a lot of irritation, and this will create some discomfort for the individual. All right. So those are the different ways the patella can sit in the groove. The patella can be misaligned, and a lot of it has to do with our muscle structure and how well our muscles are developed. Right? So the next section of our notes will come from special testing, which will either be done later this week or early next week. So take this time this week to really focus on the soft tissue components of the knee, the ligaments, the tendons, the muscles, how the patella is aligned, and try to get your quiz finished from last week. And if you have any questions, let me know.